Hello everyone. I'm just waiting for you all to join so that I can get Doctor on the line. I'm so so tired right now, and I had promised you a live. Hello, mommy. Hi, Vikrant. Thank you so much. So I had promised this live, and so I'm here. And I have left my food halfway. We were having dinner, and I left my food halfway and came running up to my room to do the live. So I can see a lot of you online. My voice is gone. I don't know what has happened to my voice. It's just gone. All right, so I'm just going to be adding Doctor. Hello, Doctor. How are you? Good evening.
Hey Rika, good evening.
So, for those of you who do not know Doctor and who are just coming to the chat, Doctor is the director of Namaha Healthcare. Am I right?
Yeah,
Yes, and he's also had a podcast which used to do very well, also currently does very well, and it's called She Said She's Fine. And you
she
have a
says
lot
she's
of
yeah.
a lot of topics that you discuss, PCODs, PCOS, miscarriage, and infertility, everything, right? Yes, so we have a lot of questions that have come in today for this chat, and a lot of them wanted to address certain issues, right from periods to menopause, and then COVID, vaccinations, and a lot more. So I'm just going to throw a few questions at you and in random order. So I can't hear you. I've lost your audio. Can't hear you. Um, can you leave and can you I send you a request again? Thank you. Can you guys hear me? Just
Can you
yes.
hear me now?
Yes, I can hear you now.
Okay,
Loud and
perfect.
clear.
So out of
Perfect.
all, I think approximately 5,000 people who are listening, I don't think anybody would
Oh
mind,
yeah.
Erika, if you just ate during the live.
No, it won't be comfortable. I won't be comfortable doing so. Um, I'm not some can you guys hear both of us?
Yeah, now I think people are saying, "आवाज आ रही है," and I can hear you. I read it. So you
Yes, loud and clear. Okay, perfect. Okay, so there are a set
cool.
of questions that quite a few of them have asked, and it is related to a lot of things. And I'm not taking anybody's name here to maintain privacy and no one confidentiality. So, firstly, the main topic is now that 18 plus, can register
Yeah,
for COVID vaccinations. There are a
yes.
lot of things that people are asking, including me, that is it safe for a woman
Hmm.
to take the vaccination? Will it kind of have any effect on fertility in the long run, or maybe
Yeah.
now?
No, not at all. Um,
Okay.
we've we've been dealing with these rumors now for a couple of weeks, and there's no
Okay.
truth to the fact that it affects fertility in either men or women.
Okay.
And there was another very, very strange rumor about you not being able to take it during your periods or before your periods or after your
Right,
periods.
right. That was another question that I wanted to ask you. So it was also said that, you shouldn't be taking it 5 days before or after your periods. So
There's
that was
no truth
another,
to it.
there's
There's
no truth to
absolutely
it. So you can
absolutely
just
none.
So you
So
can take it, right?
the logic, I mean, it's
Mm-hmm.
unfair to call it logic also, but the logic behind that rumor was that your
Mm.
immunity dips around your periods, and when you take the
Okay.
vaccine, it makes you more susceptible to getting COVID, which is
Okay. Not
absolutely
true.
untrue. Your periods don't affect your immunity, it doesn't affect how well the vaccine will act on you and give you the level of protection it needs.
Mm-hmm.
As soon as you're able to get the vaccine, take it.
Oh, lovely. And there's another one who asked, is it safe for lactating mothers to take this vaccine?
Okay, so the thing is that safety is one part of it. It is not approved
Mm-hmm.
for either pregnant or lactating mothers to take it in our country. The
Okay.
Ministry of Health and Family Welfare has not yet approved it, and
Mm.
rightly so because we don't have enough data on it. But if
Right.
you ask me whether it's safe or no, I would say that the benefits of taking the vaccine far outweigh any possible risks that may be there. And that is the
Mm-hmm.
recommendation the National Association of Gynecologists have made to the ministry to give it like a little bit of a fast track approval. Because mothers in their
Mm-hmm.
ninth month of pregnancy, eighth month of pregnancy, or even newborn mothers are very vulnerable. And at any point of time in
Mm-hmm.
our country, women who've just delivered or about to deliver consider
Mm-hmm.
about 50 million people. That's a huge
Mm-hmm.
number of people in our country who's very vulnerable.
Mm-hmm.
So the
Mm-hmm.
approval hasn't yet come, but hopefully it may come soon.
So, do you suggest that they take the vaccine or no?
No individual
No.
private practitioner can suggest any pregnant
Mm-hmm.
or lactating mother to take the vaccine because, quite frankly, it's not allowed yet.
Okay.
But
And
yeah,
yeah, sorry. And how much gap is required for one to plan a pregnancy after the vaccination?
none, absolutely none. So
Okay.
what people don't understand is that the vaccine doesn't actually have the virus per se. It's either the dead or
Okay.
inactive virus or
Mm-hmm.
particles of the virus which stimulate your immunity. So it's not
Okay.
like if you don't need to wait for your for the virus particles to go away or to
Okay.
not affect your baby. It can't
Mm-hmm.
affect your baby. So you don't need to wait for uh, any period of time after the vaccine. You can try the same
Oh.
day also.
Okay. The next would be regarding periods.
Yeah.
So, what can help with period cramps or pain? So, there are a lot
Okay.
of people, I mean, even
Not
personally
COVID
me,
related. Not COVID
not
related.
COVID really. No, I think the COVID questions are done.
Okay.
But even I suffer from really bad ache for the first day, and I have lower back pains. And there are other people who cannot even move from their beds.
Yeah.
So is there any medication? Is it, I mean, if my mom, tells me just bear the pain because, taking medications also probably might hamper later. It's not good
So
in the long run.
so all through centuries, women have been asked to just bear it or just deal with it.
Right,
हमें भी
right.
होता था.
Huh,
Your tolerance is low.
huh,
शादी होके चला जाएगा. After you
huh,
have your kids, it'll go away. So this
huh.
is ingrained since you were kids. If
Mm-hmm.
anybody listening to this live suffers from
Mm-hmm.
debilitating pain, where it affects 1 or 2 days of your productivity, like you can't shoot, for example, if it's you,
Right.
or you need to take some pill in order to allow you to shoot,
Mm-hmm.
or somebody who misses college, or somebody who misses an exam or school, or somebody who just lies in bed with a hot water bag, that pain needs to be evaluated. I would advise against just popping a pill, any over the counter pill for the cramps. I mean, in an emergency, it's fine to take any one of those common medications, but you should make an appointment with the gynecologist. If that gynecologist
Okay.
also laughs at you and says, no, no, you are too sensitive, change your
Mm-hmm.
gynecologist. Find somebody who takes your pain seriously, finds a
Mm-hmm.
proper cause for it, or at least rules out the common reasons for pain, such as if you have a
Okay.
fibroid, or if you have a thickened uterus, such as adenomyosis, if you have
Mm-hmm.
endometriosis. Once they evaluate it, they can give you treatment which makes you lead a comfortable, more productive life. So you must visit a gynecologist. Don't be afraid to visit a gynecologist,
Okay. Yeah, because a
including
lot of
you.
women, yeah, including me. No, I didn't know about this. So I will definitely get help with that because I do use a water bag, and when I'm shooting, I have to pop a pill.
Yeah.
So my first day is really, really bad usually.
If all the tests come negative, great.
Hmm.
Your doctor will put you on a regimen every month,
Mm-hmm.
give you certain tips and tricks, and tell you which pill to take to better manage it,
Okay.
so you don't end
Okay.
up self-medicating, even if all the
Okay.
reports hopefully are normal.
Hmm. Okay. So, someone asked, is it normal to get periods for just 2 days and that too with less bleeding?
So periods vary in
Hmm.
amount, in number of days, in
Hmm.
in flow characteristics also, in what color,
Okay.
when you get it,
Hmm.
etc.
Hmm. Hmm.
Anywhere between 2 to 5 days or 2 to 6 days is fine.
Hmm.
However, if you feel that your period quantity has been steadily decreasing, say
Hmm.
3 years ago you used to bleed for 5 days, proper flow, you changed few pads
Hmm.
or tampons a day, and
Hmm.
now you feel like, and I don't even need to like change one pad a day. I mean, this has gone to
Hmm.
spotting, like it's just like a stain,
Hmm. Hmm.
and
Hmm.
it's just
Hmm.
1 day and it stopped. And if you feel that that is reducing, again you must visit a gynecologist. There are certain hormone
Hmm.
tests they'll advise you. They'll do an ultrasound for you. They'll check whether you have polycystic ovaries or no. They'll check whether you have any
Hmm.
thyroid issues or no. And
Hmm. Hmm.
that's when, once he gives you the green signal, you can be okay saying, okay, my reducing periods or very, very
Hmm.
scanty recent periods are okay.
Hmm.
If that is associated with weight gain, acne, oily skin,
Hmm.
increased facial hair
Hmm.
growth,
Hmm.
so many other things, don't try to evaluate it yourself. If you're worried, what's the worst that can happen? It's a wasted visit to a gynecologist. That's the worst that can happen. But at least you'll be reassured that there's nothing else progressive happening inside.
Hmm. And there's another one that
Hmm.
she's asking, is a cyst the size of an orange to be a serious issue that would need surgery? I think that would. That sounds scary.
Okay. No, no, it's not scary, but it depends what type. There are multiple types of cysts. So for anybody
Okay.
listening, a cyst is a water-filled lesion in your
Hmm.
ovary. Now, that can be filled, either a cyst can be filled with blood, it can be filled with other
I'm
fluids, it can
sorry.
be a
I'm so
clear cyst.
sorry, doctor.
No problem.
Can you just explain this in English so that we have like
Yeah, yeah,
Hindi
perfect.
and English mix so
Perfect,
that
perfect, perfect,
everyone
perfect, perfect.
understand? Yeah.
So, ovarian cyst मतलब पानी की एक गांठ होती है ओवरी में.
Hmm.
Either it can be filled with clear fluid, it can be filled with blood की cyst हो सकती है, it can be filled with many other things. पहले तो देखना है कि किस टाइप की cyst है. For
Hmm.
very very simple cyst जहाँ बस पानी की एक cyst है, your doctor will first give you some medicines ताकि वो
Hmm.
बैठ जाए. Many very
Hmm.
often over a course of 2 to 3 months with medicines, even a 5 centimeter, 4 centimeter cyst subside हो जाती है. But
Hmm.
very rarely persistent जब cyst रहती, when it persists,
Hmm.
तभी सर्जरी करने की जरूरत पड़ती है. और if it's a cyst which
Hmm.
is not a simple cyst, it's not something to get very very scared of, especially if you're a young person. If you've asked
Hmm.
this question, please don't panic. But it certainly means that next 2 3 months आपको गायना के पास 2 3 बार तो जाना पड़ेगा.
Acha.
That is something you should understand.
So it's
Despite all
not
the
a
medicine, hmm.
so it's not a very serious issue. Matlab, it can be also, but it
Hmm.
can't be also at the same
Most
time.
of the
So
times it
not to
doesn't.
worry, doesn't.
Most of the times it doesn't end up being serious. So don't
Hmm.
panic. Go to your gynec. कोई आपको काट नहीं देगा, सडनली बड़ा ऑपरेशन करके ओवरी निकालने नहीं करेंगे. पहले दवाई
Oh,
से ही ठीक करना, वो ठीक करने की ट्राई करेंगे, एंड देन ओनली विल दे, if nothing is working out, then only surgery will be
I see.
advised.
Okay, so the next question we have here is I am 23 and I have
Mm-hmm.
green fluid coming out of my breast. What could be
Hmm.
the reason?
Many reasons. Uh,
Okay.
uh, this requires evaluation by a doctor.
A
So
doctor,
आप
yes.
yeah, so आप gynecologist के पास जाइए. Let him examine it.
Hmm.
Very often आपको जो green लगता है, that is slightly yellowish white mixed, जो early milk type of secretion होता है वो. Now you may not be
Oh.
married, you may not have a child, you may still get it
Hmm.
because of certain
Hmm.
hormone imbalances. That is the most common cause of it. आपके
Okay.
डॉक्टर चेक करेंगे, कंफर्म करेंगे कि ये हो रहा है. दे विल सजेस्ट
Hmm.
सम ब्लड टेस्ट फॉर यू, इंक्लूडिंग थायराइड, प्रोलैक्टिन एक्सेट्रा. वो रिपोर्ट देख के आपको दवाई देंगे. If you don't have any
Hmm.
lump in your breast or anything else that you feel in your breast, or if it's not a blood mixed discharge, please don't panic. Just go to your gynecologist.
I had no clue about this, so for me, this is like something new.
Yeah, yeah, but
Can
there's no reason
some,
to panic. Yeah.
yeah. So the next question is, can one take antidepressants during pregnancy?
Yes, but pregnancy safe antidepressants. So if अगर आपको कोई antidepressants अभी चालू हैं and Say
Hmm.
you are thinking कि अभी pregnancy plan करनी है, visit your psychiatrist. Tell them that I'm now we're now going to try for a baby. Is there
Hmm.
something pregnancy safe that you can put me on? और अगर आप ऑलरेडी
Hmm.
प्रेग्नेंट हो चुके हैं और थोड़ी दवाई आपकी गई है, डोंट पैनिक अगेन. Tell your gynecologist, tell your psychiatrist, they will switch you over to something that is
Hmm.
safe for your baby. But yes, you can, there are some medicines that are safely taken during pregnancy.
Okay. What are the different kinds of vaginal discharge and how to differentiate कि कौन सा normal है and which is not? I mean, like, which is
So,
bothersome.
vaginal discharge बहुत common है. I mean, everybody
Hmm.
has it.
Hmm.
For anybody listening, don't consider yourself um, uh, abnormal in
Different.
some way or dirty or different in some way, because
Hmm.
some amount of discharge is there for everybody. और वो depend करता है आपके what time of your cycle you're in. The
Hmm.
commonest type of vaginal discharge is a clear discharge. It's very slimy,
Hmm.
almost like saliva type of discharge.
Hmm.
वो बहुत कॉमनली 2 periods के बीच में होता है, स्पेशली जब ओव्यूलेशन, जब एग आपका बनता है तब. it
Hmm.
it
Hmm.
aids fertility, etc. That's your body's natural response. uh,
Hmm.
if you have discharge which is bothering you a lot throughout the day, like पूरे दिन अगर
Sorry.
ऑफिस में या I need to wear a panty liner and I need to wear a panty liner and it's very
Hmm.
uncomfortable. I need to keep going to the loo and like cleaning up. Or if you feel that your discharge is white, almost curd like, almost yogurt like, or if it's little frothy green, those are signs of some form of infection, either a fungal infection or some other kind of infection.
And
And you need
also,
to,
there is a foul smell to it if
yes,
it's
yes,
an
yes.
infection as well.
Anything other than your normal odor, anything
Okay.
other than your normal odor, go to your
Hmm.
gynecologist. Again, it's a very, very simple thing to solve. The
Hmm.
only mistake that people generally tend to make when they have a lot of discharge is that they blame themselves, thinking that this is more of a hygiene issue. So
Hmm.
most of the people who will come in, they'll be like, but I am very clean. I clean it very rigorously. And they'll use the
Hmm.
bidet a lot. In the shower, they'll use a lot of soap or some form of vaginal hygiene product, which are available
Right.
everywhere now. And they'll
Right.
keep using that and they'll keep
Hmm.
cleaning and they'll keep cleaning. What they don't understand is
Yeah.
that makes it worse.
Yeah. That was my
The
next question.
पूछ लीजिए. You ask me, then I'll
नहीं
answer that.
वही the vaginal that intimate washes that they have that
Hmm?
they keep
Hmm?
advertising. So if you use it on a daily basis, do they increase chances of infections and yeast
Yes.
infections and stuff like that? They do, right?
You are not supposed to use any intimate washes. So a lot
Oh,
of
okay.
people prescribe intimate washes. It's all
Hmm.
over the market. The thing is, the
Right.
vagina is a self-cleaning organ.
Okay.
If you have infection, the infection needs to be solved by you rigorously cleaning it and rubbing soap on it or hot water or one of these
Hmm.
products that you
Hmm.
mentioned.
Hmm. Hmm.
You wash out all the good bacteria,
Good
all our skin,
bacteria.
around our
Hmm.
body, on my skin,
Hmm.
on anybody's skin, inside our mouth, nose, vagina, everywhere. It's teeming with bacteria. ये
Hmm.
बैक्टीरिया हमारे लिए बेनिफिशियल है. They're
Hmm.
protectors of our body. If you
Hmm.
wash out these bacteria by using soap etc, thinking कि आपकी hygiene deficient है, it gives a
Hmm.
chance for the fungus to grow. The
Okay.
idea is get your infection sorted, don't use any of this, and
Hmm.
don't touch your vagina so much, as in the shower or
Hmm.
with
Hmm.
soap
Hmm.
or
Hmm.
hot
Hmm. Hmm.
water or Dettol or anything like that,
Hmm. 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 Hmm.
mistakenly thinking कि इसकी वजह से आपको हो रहा है.
Okay.
So no vaginal
So,
products
so you're not supposed to be using them at all,
at
not
all.
at all.
So
So,
women are made to
okay,
now think by society
right.
that they're supposed to smell a particular way, even by many of their
Mm-hmm.
partners. And so
Mm-hmm.
they get embarrassed by what is a natural odor.
Right.
This forms the chink in the armor to push in products.
Products. Yes, because
So
there are
no.
so many. There are like washes, there are creams, there are powders, there are so many things that have come, and also perfumed products. So that increases a
Hmm.
lot of
Hmm.
things, right?
Yes, they're all irritants to an area which is very, very sensitive.
Sensitive. Okay, so I am going to throw out my intimate wash because I don't need it anymore.
You don't need it.
Okay. Does one need to, does one tend to gain weight during menopause and will exercising help?
Well, exercise always helps.
Mm,
Whether you are overweight or whether you aren't, some form of exercise around the time of menopause, especially, will not
Mm-hmm.
just help in weight, but also help in your bone mineral density. It prevents fractures, prevents osteoporosis, keeps your muscles healthy, supple, increases your
Mm-hmm.
circulation. It even
Mm-hmm.
reduces other symptoms of menopause, such as a little bit of anxiety, palpitations, a little bit of emotional vulnerability, जो creep in हो जाती है around that time because
Mm-hmm.
of your body is entirely changing. How it changed from when you were a
Mm-hmm.
kid to a teenager, so now teenager
Mm-hmm.
to from a reproductive age group to a non-reproductive age group. So your body is going to undergo changes. The only thing that I would say is that it's a huge change for a woman during menopause. So there are many women who will come in and say, "But doc, my diet has not changed in 20 years. I do the
Mm-hmm.
same amount of ghar ka kaam, everything I'm doing. I work, I do, but for some reason, like I'm putting on weight. So
Mm-hmm.
that's when it's difficult to tell them that, look, you are a different person now.
Mm-hmm.
The same rules जो आप 42 थे don't apply when you're 52. You need to
Mm-hmm.
understand that your body's requirements have changed. आपका आपका
Mm-hmm.
diet भी थोड़ा आपको change करना पड़ेगा. आपका daily activity you'll have to change. Maybe you might have
Mm-hmm.
to work a little harder if you just want to look the same at 52 and you did at 42.
Mm-hmm.
So
Mm-hmm.
in an indirect way, yes, your body does change. Some do end up putting on weight. Yes.
So, also, someone was asking about what is the ideal age where, I mean, when normally menopause
Of
comes
course,
in?
it
Yeah,
depends.
yeah.
Anywhere from 46 to 52. So it depends on
Okay.
your genetics. It depends when your mom had it. It depends what kind of genes you have, how many eggs you have left.
Mm-hmm.
But some women will have their menopause at 52. Some will have it at 45, 46. So it
Okay.
depends. There isn't like an absolute certain age where it's
Mm-hmm.
going to happen for it. It can vary among sisters as well, sometimes by a couple of years.
Okay. And with menopause again, how to handle hot flashes during the menopause, and are there any over-the-counter medications for this that you could suggest?
Um, the hot flashes occur because आपके जो body के hormones हैं जो ovaries बनाती हैं, those are gone now. And
Hmm.
estrogen, the hormone which your ovary makes,
Yeah.
affects each and every part of your body, right from your brain to your skin to your
Mm-hmm.
hair to your blood vessels to your heart to your
Mm-hmm.
bones, everything. This
Mm-hmm.
sudden withdrawal in menopause is what causes these changes. Uh, Speak to your doctor about hormone replacement therapy, about estrogen replacement therapy, where they can put you on certain tablets or certain gels
Mm-hmm.
uh, after doing a few tests for you. Over-the-counter medications don't work as well as estrogen replacement therapy, but there are a
Mm-hmm.
few available. I,
Mm-hmm.
I can't name them by names, but
Okay.
they have a certain plant derived estrogens in them. They're almost like
Okay.
nutritional supplements, which
Mm-hmm.
although वो डॉक्टर की दवाई जितने पोटेंट नहीं है टू बी ऑनेस्ट,
Okay.
बट
Mm.
यू कैन इवन आस्क योर डॉक्टर कि ऐसे कोई कैल्शियम के साथ मिक्स्ड टैबलेट्स हैं
Mm.
आइसोफ्लेवोन्स वगैरह वाले जो may ease my
Hot
problems, then
flashes.
yes, the
Okay.
answer is yes. Yeah.
Hmm. And okay, there are a few questions that I got regarding this. There
Hmm.
have there have been girls who are young girls and who have
Hmm.
tested positive with corona,
Hmm.
and they said that they were on medication and have missed their periods. So
Hmm.
is it because of the medication that they have been taking?
It's difficult to say. Uh, Being a doctor, I know it's hard to listen to this, but हम अभी भी सीख रहे हैं ये बीमारी के बारे में.
True.
Um,
Yeah.
yeah, we don't have all the answers yet. पहले क्या
Hmm.
होता था? I mean, if you asked me 2 months ago, I also said what rubbish. COVID doesn't cause anything. This, that.
Hmm.
But उसमें क्या होता है कि then you tend to negate suffering of other women. So I don't
Hmm.
want to, for women who have had period issues after,
Hmm.
say, getting COVID or even, say, sometimes even after a vaccine, I don't want to minimize their suffering. But what I
Hmm.
will say is that there is no scientific basis yet जिससे कि
Hmm.
ये हम link कर सके. But very often, periods are known to go a little haywire in times of stress, in times of extreme illness, in times of
Hmm.
extreme weight loss or extreme calorie deficiency, etc. So
Hmm.
it may be because of that and not actually the virus or the medication.
Hmm. now PCOD and PCOS. They wanted to know if, first of all, how do you diagnose or self-diagnose this that you have PCOD or PCOS? Because a lot of them have been asking me about, I have irregular periods and I don't get my periods for 2, 3 months. So how, they should know what it is.
Yeah. So, for sure, don't diagnose yourselves, girls.
Not diagnose yourself,
But
but if you're
suspect it.
missing,
But if you
yeah.
suspect it, yeah. So,
So,
uh, so if you, when you should start suspecting that something may be a little off, if
hmm,
your periods are very, very irregular, अगर
hmm,
45 days हो जाते हैं आपको period को or
hmm,
more, if
hmm,
your periods start becoming a little scanty,
hmm.
these are the most common presentations of PCO. However,
Okay.
many girls, even with regular periods, every month, spot on, date to date periods, three to
Hmm,
5 days, perfect, nothing changes,
hmm,
may still have polycystic ovaries, but they may have the other symptoms, such as
hmm,
unexplained weight gain, oily skin, acne, backne, uh,
hmm, hmm,
increased facial hair growth, increased
hmm,
skin pigmentation around the necklace area,
hmm,
increased skin pigmentation in other parts of the body. अगर ये
hmm,
सब कुछ भी है तो it is worth
hmm.
undergoing an evaluation for polycystic ovaries.
Okay. And are they likely to have any problems with pregnancy?
So when you say that are they likely to have any problems with pregnancies once they are pregnant, तो no. One एक बार pregnancy
So
रुक
in
जाए फिर तो
conceiving.
कुछ नहीं. तो uh, when any girl, it's so common polycystic ovaries that
Hmm,
everybody who's listening, उसमें से आधे लोग को शायद polycystic ovaries हो सकती है. So I don't want
hmm,
all of them to think that they're going to struggle to conceive. Most of the girls
hmm,
जिनको polycystic ovaries है वो mild रहता है and you may
hmm,
still be able to conceive. For the
hmm,
other girls, yes. If the real honest answer is that yes, sometimes
hmm,
you will struggle to conceive, and that's for a very simple reason कि आप predict ही नहीं कर पाते हो कब आपकी का egg release होगा, when you will ovulate. So you don't know when to try.
hmm,
If you have a
hmm,
60-day cycle, when do you practically try? Where do you try on day 15 or do you try on day 30 or do you try on day 45? So
hmm,
that makes it very, very hard. And sometimes तो कभी egg बनता भी नहीं, like you don't even ovulate.
hmm,
Polycystic ovaries means that you have disordered ovulation or poor
hmm,
ovulation
hmm,
or no ovulation. So that's why they struggle to conceive. But let me tell whoever is listening that if you go to a competent gynecologist in your
hmm,
area,
hmm,
anybody who's experienced in dealing with fertility issues, they
hmm.
will guide you towards how to make you ovulate a little more regularly and how you can try to conceive easily.
Okay, so I'm done with my questions, whatever I had to ask. Would you like to answer any of the questions that have been asked right now on the live?
Okay, there are a few very specific ones, so I'm just going to
Yeah, so
tell them
whichever
that
you,
no.
yeah,
So let me see. I
yeah.
don't have access to all the questions. Do you want me to see? Most of them are just saying how much they love you and how
No,
much.
there were quite a few related to menopause up, and also
Wait,
the same thing with that we've spoken
how to
about,
get rid of? So there's
lactating
one.
mothers COVID vaccine.
This is interesting. How to get rid of rashes during menstruation?
Hmm.
Um, Change the product that you use. Change the hygiene product that you use. Try to use cotton undergarments. If you're not comfortable with sanitary pads, try switching over to a menstrual cup or a tampon. It's more
Hmm.
of a trial and error thing. So see what works
Hmm.
best for your body. Can you tell us if breastfeeding mothers can take the COVID vaccine? Officially, no, it's not yet allowed, but hopefully soon. Hopefully, the government is going to approve it soon, and then you will be able to take it. I think that you should be able to take you. I hope that you're able to take it soon. There,
So is
so many
PCOD and
comments.
PCOS the same?
Yes. So this is some weird other thing that people keep going on about. Do you have PCOS or do you have PCOD? It's the same thing.
Okay.
The reason why it's been shifted is because nobody wants to assign the word disease to something
Okay.
that is, we don't call getting spectacles a disease, or we don't
Hmm.
call having hypothyroidism a disease per se. So it has a
Hmm.
negative connotation, and plus because
Hmm.
it just doesn't have one problem, it has multiple system involvement. It's a
Hmm.
syndrome. So it's always
Okay.
polycystic ovarian syndrome.
Okay, there's
Okay,
another
if
one.
you can
Please
also find
explain
some,
about my
yeah.
ectopic pregnancy since I have lost my one fallopian tube. What are the chances of getting pregnant? I'm 35.
Um, your chances, if you've conceived naturally before your ectopic and then you've had an ectopic, then the chances are good that you might conceive. But just be little careful of one thing, that the commonest reason an ectopic pregnancy means जब pregnancy tube में फंस जाती है, is that there is some form of infection in the tubes. Very often, it is not isolated to one tube. It is also part of the other tube. So the next time you do end up conceiving, you have to go to your doctor slightly early ताकि वो rule out कर दें ectopic pregnancy पहले से, ताकि आपको इतना सफर ना करना पड़े जितना आपको एक ट्यूब निकाल के सफर करना पड़ा है. The other thing that you can do is before you try to conceive, go to your gynecologist, ask him to check the other tube by a test which is known as an HSG, and
Hmm.
then give you the go ahead to try for your next pregnancy. Okay, there
Okay.
were also using pads can cause cervical cancer. No, not true.
Okay.
Not true.
Do fennel seeds cause irregular periods and undeveloped breast?
No, nope,
I've not
not true.
heard of that.
Even I've not heard of that. But I mean, for anybody, please go eat your fennel seeds. I was was
Sir,
getting
is
it after. Okay,
contraceptive pills safe to take? Is
yeah,
contraceptive pills safe to take?
yeah. I mean,
So if someone's
nothing.
trying to conceive, do they have to get off the contraception for a couple of months?
No. So this is
No.
another misconception. There are many patients who ask me like, okay, but then I have like a 3 month washout period. It'll be in
Uh-huh.
my system. The answer is no. You can conceive the very next month of your contraceptive pill stoppage. So don't worry about it. Quite frankly, your fertility is highest the month just after you stop, because your body
Oh.
gets back into action.
Oh. So someone's asking, I had two miscarriages. Can I get pregnant naturally? I'm 34.
Yes, but if you're 34 and you've had two miscarriages back to back, you must evaluate, rather rule out the common causes of miscarriage since you're already 34. When you're 34, your fertility rate kind of slips a little more than it would when you're in your late 20s or early 30s. So go to your doctor. He'll give you a list of tests to do. Find out the common reasons. There are some blood tests, there are some other tests, such as an ultrasound also, which checks the inside of your uterus, etc. And common causes आप rule out करा दो कि आपको कुछ नहीं है, husband को कुछ नहीं है, अंदर everything is okay, and then yes, you can try naturally.
Okay. Can women above the age of 40 take cervical cancer vaccines?
You're on the borderline of cervical cancer vaccine. We have had patients who've taken it even at 41. But the older you get and the longer you say you've been sexually active, you have to
Hmm.
understand कि जितना 16, 15, 12 year old girl को फायदा है वो वैक्सीन से, आपको उतना फायदा
Hmm.
नहीं रहेगा. थोड़ा बहुत तो फायदा रहेगा, because you never know when you may be exposed to the papilloma virus in your life. So
Hmm.
if you're worried, take it. It's no guarantee that it will prevent it, but
Hmm.
there's certainly no harm in taking it.
Okay, and there was another question for fibroids. So, there are two ways of going about it. If they are smaller, then you have the laser treatment, and if they're bigger, then they are asked to take off their uterus. Is there any other alternative
No,
to
no,
it?
no, 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 no. So, removal of the fibroid, no matter how big or how many,
Hmm.
depends on where that lady is in her life. Now, suppose
Okay,
वो 48, 49
so
years
let's talk
age.
about a youngster.
Yeah,
Let's talk
so a
about a
youngster,
middle-aged,
very.
and let's talk about a senior.
So when you're a youngster, we always try to preserve the uterus.
Right.
जितना भी बड़ा fibroid हो,
Hmm.
जितना भी बड़ा fibroid हो, we try to preserve the uterus. And no matter how big the fibroid or whatever, you can still do it laparoscopically, which is common in
Hmm.
lay people. Some people talk about laser. It's not really
Hmm.
laser. It's just like keyhole surgery, and the fibroid
Okay.
is removed through that because they're less. It's a smaller incision, etc.
Hmm. Hmm. Hmm.
Uh,
Hmm.
so once you're middle age, say you're in your mid 30s, you've had one kid, you want one more. Again, fibroid ही
Hmm.
निकालना.
Hmm.
Whenever in your life, now whether you may be 38, 39, or whether you may be 48, 49, your kids are all grown up.
Hmm.
There's a large fibroid. There are multiple fibroids. Uh,
Hmm.
you're bleeding heavily to the point that by your hemoglobin is going down. You need to go to the
Hmm.
hospital sometimes to get it stopped.
Hmm.
Then once that is the case, you give the option to the lady कि भाई ये recur हो सकता है. We'll remove all of it now, but there are so many. There's always a chance that your bleeding, heavy bleeding, will still persist. And if your
Hmm.
family is complete, you're not interested in more kids, etc., you do a
Hmm.
hysterectomy. So that's the time. That's
Hmm.
the only time where, because of fibroids, we'll do a hysterectomy. When she's
Okay.
done with her reproductive life. But we don't remove the ovaries during the hysterectomy. So she will still have
Okay.
all the benefits of her hormones and everything. She just won't
Okay.
bleed or have the pain.
Okay. I think we have more or less covered most of the issues, and we can definitely have another live talking about infertility and IVFs and other alternatives to pregnancy. So we can definitely do that sometime soon. And it was great having you on this live, doctors. Thank you so
It,
very much for answering all the
it
questions.
was my pleasure, Erica. Good to
Thank you.
we'll do more specific ones later then.
Yes, yes, we will. I
Thank you
hope
for
you guys
having
have
me.
got your questions answered, and this one's going to be saved on IGTV, so you all can just view it. All right, thank you. Bye bye. Good night. Bye, doctor. Thank you so much.
Good night, everyone, and
Good
thank you for
night.
having me, Erica.
You're welcome. Bye.